Hello everyone, welcome to sqadia.com. I'm Hina Khan and the topic under discussion today is the childhood disorders. Some of these disorders we have already discussed in the previous lecture and some of them will be discussed today. Now there is a range of disorders that basically manifest in the childhood of a person, and obviously the two major components that undergo the definition of the childhood disorders are the emotional and the behavioral content of that person. So these are the disorders that we'll encompass today. In the very first section, we'll be dealing with the emotional disorders primarily. So just to give you an introduction related to these kind of an emotional disorders, and then we'll go about the classification of these emotional disorders, ranging from the emotional component as well as the behavioral component is sometimes affected due to these pathologies. Now the prevalences will also be discussed over here. There are different epidemiologies, and so we'll be discussing them all over here in this very first section. In the second section, we'll go about the attachment disorders. How do you basically define the attachment disorders? Obviously, usually these attachment disorders regards the childhood of the person, but obviously some of the adolescents are sometimes also affected through these attachment disorders. So we'll be discussing the ambivalent attachment, the unsecure attachment, and then after that the avoidant behavior that is due to the avoidant attachment. So these are the kinds of different attachment behaviors that the person undergo, and what kind of the emotional and behavioral effects these attachments have in the person's life. We'll be discussing them along with that. In the third section, we'll be dealing with the reactive attachment disorder. So after the person is exposed to these different kinds of attachments, he basically behaves in this particular manner, which is known as RAD, abbreviated as RAD, and also known as the reactive attachment disorder. So we'll be basically knowing the types of the treatments that are related to these kind of attachment disorders. Then the DSM IV criteria for the reactive attachment disorder, which is very important for the diagnosis as well, because the assessment of the patient over here is very important. So the placement of a child with the reactive attachment disorder, it's also going to be discussed over here in this very third section. In the fourth section, we'll be discussing the separation anxiety. So the clinical presentation is going to be quite similar to any anxiety disorder, but still the causation factors, basically the separation of the child from his or her parent or the primary caregiver. So we'll be discussing the definition of separation anxiety over here, and moreover, we'll be discussing the etiology and the management guidelines that we are going to ensue when we are dealing with a patient of separation anxiety. In the fifth and the last section, we'll be discussing school refusal. So it's one of the behavioral disorders that we see in the childhood of a person. So what are the causes of the school refusal? How do you deal or manage such children who are basically refusing to go to school? Or even it can be the population that is involved in this kind of a behavior. It can be the adolescents as well as the children. So we'll be discussing the prognosis in the children and as well as in the adolescents over here in the very fifth section. So I hope you want to learn more about these childhood disorders. So do watch the other sections to this lecture as well.